Good morning, YouTube family. We're back here at Beverly Hills Dentistry. My name's Edwin. I'm one of the coordinators here at Beverly Hills Dentistry. And today we are actually doing a tooth extraction. What does that mean? We are taking out a tooth. We're going to clean out the infection and we're going to place a graft to allow the area then to heal, and the patient will be coming back in a couple of months for a dental implant placement. Let's check it out. This is the x-ray of the tooth. Now what's happening is the patient had a root canal that was done many years ago. Unfortunately, the root canal was not done correctly, and then there was a crown placed. Now what ended up happening is now it's been a couple of years, and now the patient has developed an infection. So what you see here in the black is an infection. Now the patient is not feeling any pain or discomfort, but when he came in for his checkup, we noticed this. We talked about this with him, and he actually had a bit of a bubble, which was the infection trying to come out. So now what we're going to do is we're going to take the tooth out. We're going to clean out the infection. We're going to place a bone graft to bring the bone to this level here. And we're going to let the patient heal approximately 3 months. Then we will go back in and place a dental implant. Now, if we don't place a dental implant, what's going to end up happening is that these teeth are going to want to come together, and we want to avoid that. So we're going to be starting the surgery in a couple of minutes. It's today's surgery is scheduled with Dr. Martinez. So you guys are going to see Dr. Martinez perform the surgery, and the patient is going to be completely comfortable. It's going to be numb during the whole process, and then we'll get him going. Follow me. All right, so we have Irene here. She's a phlebotomist. And Irene, what did you do? Where are we at right now with the first steps?
So we went ahead and we're going to be extracting our patient's tooth. And what we want to do is we want to go ahead and prepare a sticky bone for doctor. And now I'm in the process of creating the membrane and the plug. The doctor will go ahead and use and put in the extraction site. We're going to pack it in with some bone. We'll see the patient back in a few weeks. But pretty much the reason we do this is because we want to go ahead and promote healing. And there's nothing better than having the product come from the patient self. So we draw the blood here in office with tender love and care. And then we go ahead and use the centrifuge here to go ahead and process it. Afterwards, we'll go ahead and get the vials. We'll pull this out with a syringe, and then we'll be using...
So that comes from the patient's own blood?
Yes. After we centrifuge it, the red blood cells drop to the bottom, and then this comes to the top, and we just extract this and put it in a syringe. So the doctor is able to mix this with the bone and place back in the socket.
Like a little pimple that kind of drains out pus? Mm-hmm. Okay. So that's called a draining fistula, right? Your body is trying to get rid of the infection somehow. And luckily for you, it's outward. If it was inward, you could end up in the hospital. So what we want to do is make sure that we take out that sick tooth, okay? And then we'll graft it so that you have adequate bone. If you don't get an implant here, most likely what's going to happen is you're going to start to lose the bone in your jaw, right? So it looks like you work out. If you stop working out, your muscles go away. Yeah. It's the same with the bone, okay? An implant will maintain the bone healthy because when you chew on it, you're exercising that bone in your jaw, okay? You can get a bridge, but then you can't do all the good stuff like flossing and cleaning underneath, so it just becomes a lot of problems, okay? So I think in terms of the hierarchy of treatment, the best thing, especially for your age, is to consider an implant. Any questions before we start?
No questions. No? All good.
Okay. Let me take a look here. I'm gonna gown up. So we're gonna give you what's called the block. So everything on the left side, including your tongue on the left side and the bottom lip on the left side, is gonna feel big. Okay. Let's take a look here. Yeah, so you got a little pimple that's kind of oozing blood there, huh? So you can see a little tiny pimple right here. This is typically where the pus is coming out. So if we kind of press it, there'll be some pus coming out of there. Okay, so let me just show you. You're gonna open really big. So it's gonna be a shot here, okay? I need you to just open big the whole time, okay? Awesome. Perfect. Done this before, huh? All right, so loud. So what we're gonna do is graft the area. So we're gonna clean up the tooth, take it out, clean the infection, and then put an allograft, which is a cadaver bone in there. Cadaver bone, because it's human, it allows your body to replace that, so you get a lot better healing. We also took a sample of his blood, so we're going to put a little clot on top to allow the gum tissue to heal better and close up better. We will suture him up, and then he just comes back probably in a week just to make sure that everything is healing properly. We'll give him post-op instructions, but overall, you know, he's going to be pretty comfortable. It sounds invasive, but it's a very predictable procedure. It's probably going to be the best thing he could do for his future, right? Because like I said, that tooth gets beat up so much because you really chew with it that it's common to get failures in the area. But because of that, it's super important to always replace it.
Awesome. And then what's the reasoning for the graft? Like, is it always recommended that once the tooth comes out, it gets grafted? So
the graft is a placeholder, right? Your body will make bone, but if we are grafting the area, what we're allowing is for the healing to take its time to replace the graft material with his own bone. And in a way, we're ensuring that that architecture, right, the height and the width of his jaw remains intact so that we can predictably place an implant. A lot of the times, if there's a bony defect where maybe the walls aren't very high, he will grow a bone, but if we're not promoting the adequate size, then the implant will have to be a little deeper, or he'll have to get a subsequent bone graft, a little bit more invasive at the time. There's nothing better to place a graft when the site is healing, right? To provide new cells that are going to allow the healing process to go right. How do you feel here? Starting to? Mm-hmm. Okay. Your tongue's going to feel numb, and then your lip's going to feel that you were just in an MMA fight. Yeah, so what we're trying to do is try to do the most atraumatic extraction. If we can take out the tooth in one piece, it's good. But what we want to focus on is preservation of the architecture of the socket. So because it is a root canal treated tooth, sometimes they are very delicate. So I would just rather cut the crown off and section the roots by themselves. Like I said, just to kind of make sure that the jaw, the socket, stays intact to hold all the bone graft. Alright, so we sectioned off the tooth, and now this back root, we're going to take out the roots individually. And you can see here. So part of the reason this failed could be that the root canal was overfilled. That puts a lot of stress on the bone. So now we're going to take out the other part of the root, and the socket is intact. Cure it. Actually, let's rinse first and then we'll cure it. Open big, please. Thank you. So now we're going to clean up and get rid of the infection. Mm-hmm. We're going to scrub in there.
You have the little.
Okay. Yeah, so there's a big infection here. So what the infection usually shows up as, it's like this little balloon lining. As the body tries to wall off the infection, it creates almost like a little pouch. And so we're going to scrape that up. We can't leave it in there because that won't allow the bone to grow in properly. And it's called granulation tissue. So we got it. There, so this is what's called granulation tissue. And it's a very leathery type of infected tissue. You doing okay? Mm-hmm. Good. Now here's the big part here. Oh, there's a lot. And as we're scraping, we've already checked the CT to make sure that we're far away from that nerve at the base of the root. A little bit more. Okay, perfect. All right. So now, we put the graft material. Now we're going to put a non-resorbable membrane, and we're actually going to use the clot that the patient provided, which is going to allow for better healing of the gum tissue. It's also going to protect the graft material. Hold this. Just lay it on top. And because these are going to have healing factors, the gum tissue is going to heal a lot faster. So just bite down gently. You don't have to put a lot of force, just gently. Okay? You're good to go. Alright?
How's that?
Good.
Not
And
bad.
we'll do it again.
Yeah.
10 out of 10.
Hopefully not.
One and done, that's it. Cool.
So, if you can see here, alright, so this is basically the membrane that you've provided, right? So that has all the growth factors, so your tissue's going to heal really nice. These are non-resorbable sutures, so that's what I'm saying. If these unravel, please come back to us, okay? And underneath this is a non-resorbable membrane. It's a white film to keep the bone in there, okay? So we're going to take an x-ray, and then this site will be ready for an implant, and then we'll put the implant, and you'll be pretty happy restoring your bite, okay? Awesome.
Thank you.
Yeah, man. You did great.
Thank you.